What was the staff structure when you were first at Old Main? There were nurses and there were attendants and there were doctors, and what was the mix and the
Yeah, the hierarchy of staff in Old Main Building consisted of the doctor, who was considered the very epitome of knowledge, uh, and then we had nurses, but mainly the Old Main was run by staff attendants. That was the highest level of a staff, senior staff attendant in charge of wards. Up until the time we entered nurses training, that was basically how the facility was run, with staff attendants. And then RNs came more when the nursing schools were developed in the state of New York, and they were the ones that were in charge of wards with attendants. And there was usually one nurse in charge of the ward, and then there were attendants. And that really was the structure on the 3 shifts. On the 11 to 7 shift, in the beginning, there weren't enough nurses, so that was a shift that was deemed able to run with, staff attendants in charge. And at one time, the staff attendants passed the medications, did the treatments, and really were responsible for patients. And in the beginning, staff attendants lived on the 3rd floor in Old Main Building, and they really were not supposed to socialize with each other. They had very, very little time off during the week. Were expected to be available for any kind of an emergency, or once staff didn't come into work, that the staff that lived there were expected to fill in. They did receive their meals, their room and board. I don't know how much money they did receive at the time. I don't think it was very much, but it was a steady way to earn a living. And from my experience, there were so many families who had brothers and sisters and working there because their parents had worked there, and cousins and aunts, and it was just like one big extended family at the time. And that continued through the years too, because working in a mental hospital was not thought, as time went on, to be a very good profession. And that's why so many of the physicians that worked in state facilities were imported or were encouraged from other countries to work at our facilities. And that's how we ended up with so many foreign doctors. Nurses were encouraged because of the nursing school that was established at state facilities. It was excellent training, and after 3 years, you were encouraged to work there as a nurse. Our nursing class had 13, and four of us spent our entire nursing career at Mohawk Valley Psych Center. I had the longest years, 43 years, when I retired as a director of nursing. So
That's a long time. During the early years, particularly when you were in Old Main, and that was only a couple of years, right?
Our nurses training was spent there, and then after that I worked mainly in Brigham Building, but then I became a nursing supervisor and was responsible for making rounds in all the buildings on the night shift.
So that included Old Main up until 1978.
Yes,
when
yes,
it was closed.
yes. Mm-hmm.
And during those early years in particular, how much contact did doctors have? And these were all psychiatrists, right?
Yes.
Okay.
Yes.
How much contact did psychiatrists have with the patients?
Treatment by physicians, by psychiatrists in those days when Old Main was opened, was kind of limited because there weren't that many psychiatrists, and when they made rounds, the patients that they mainly saw were the ones that were either having extreme problems, or the ones that the nurses would say, would you please see such and such? And I believe every month they had to review the medications and or treatments that the patients were on, and orders had to be rewritten.
Okay. Do you remember any patients being quarantined at Old Main?
In Old Main, we had, on the second floor, there were 4 typhoid carrier female patients, and they were confined to a very small area consisting of their bedroom, and I think there was one other room that they could sit and have meals, but it was all cordoned off from the rest of the patients and the staff. And the staff that went in there had to wear gowns and masks and everything. But they spent years confined in that area. And the thing is, I don't even know if they had that they had mental problems that would warrant their incarceration for all those years. At that time, it was very easy to have people admitted to psych facilities without much cause, and that's why our population grew so drastically over the years in all facilities in the entire country.
Can you describe at all what that process would be like? What would it be like if a family member was having problems and another family member decided that MBPC would be the place for them to go? Yeah. How would that work?
I can recall a case where, as far as an easy admission went, was, and this was discovered years later when I talked to a couple of family members of this woman. Her husband had decided, well, this gentleman, who was an upstanding member of the community, was sexually abusing his daughters, 4 of them. And the mother would try to intervene, and each time she tried to intervene, he had her admitted to the psych facility, claiming that she was not able to function and that she was hearing voices and seeing things. And that went on for many, many years. It was one of the saddest stories I ever came across at the facility.
So, in your remembrance, would it be possible for a husband like this to show up at the facility? I'm thinking that there was that grand entrance in the beginning, or in the front, and simply tell the people there that she was hearing voices, and that was it.
It was a very easy process, especially a man-to-man thing, a man to a psychiatrist. It was extremely easy in the beginning days, and of course, as time went on, that practice certainly was not in effect anymore.
Do you have any like a favorite success story, patient success story?
That's a good question.
Oh yes. We had so many success stories at that facility, because we had a very dedicated staff who really wanted to see our patients succeed and would go to any lengths in order to help them develop skills in order for them to be discharged. We had some young people there who just needed to be put on the right combination of medications and who wanted to go back. I remember one particular young man who wanted to go back to live with his mother in Canada, and because he had wandered away and had ended up at our facility, we had to make all kinds of arrangements for them to be discharged back to another country. And it took us some time, but we were able to do that. We established contact with the agencies that would provide continuing care for him. That happened day in and day out at our facility. I have many little thank you notes from patients' mothers for doing whatever we could. Yes.
Were there any things about your duties at Old Main that you really didn't like?
One of the things I really did not like at Old Main was having to make rounds the very first time, actually for a whole couple of weeks until I learned my way around, because of the dark corridors and the twisty hallways and the back stairways, and I got lost more times than I can tell. But there was one patient who would stay awake those first 2 days. She was a very light sleeper, and she would point me the way to the next floor to go down, which stairway and all, and I so appreciated that. We had several stories of patients helping staff through the years in Old Main. One of my classmates was working on the 3 to 11 shift, and a toilet overflowed, and she was new. She didn't know who to call, and a patient said to her, she asked a patient, you know, what should I do? Who should I call? And she said, there's nobody here on weekends to call. Let me get you the plunger. So she got her the plunger, and my friend had to unplug the toilet. But we did all kinds of things there with the help of patients. There were so many people there that were so helpful and really didn't belong there. And we were so happy in time to see those people leave and lead very productive lives in the community.
I've read that at certain times during the history of the facility, some of the higher functioning, more reliable patients were actually allowed to work outside the facility.
Yes.
Was that the case at all when you were there?
Regarding patients able to work in the community, that was really part of people's discharge plans as time went on. They were encouraged and helped to get community jobs and to work. We helped people look for apartments. It was a very successful endeavor because work is such a part of everybody's life, and the need to feel productive is so evident when you have a good job. So that was something that happened. We had people working in all areas of the community as healthcare workers. We even helped people go to school in order to become certified nurse assistants. We had people engaged in every part of the workforce in the community, and they would come back, and social workers would work very in depth with them so that they could find community placement as far as apartments, and also to try and find social places in the community, because one of the most difficult things patients had when they were discharged was finding some people that they would be able to do some recreational things with and to socialize with. And one of the biggest advocates for us in the community were churches. And several of the area churches like St. Francis devised programs so that if we found people, houses down in that area, they would welcome them into their social groups.
And you grew up in Utica, correct?
I grew up in Utica and have lived here in New Hartford all my life.
Do you have any memory of stories that you heard about Old Main or about the facility before you started as a nursing student? Many of us heard many stories because several of us were from the Utica area about Old Main, and it had to do, many of them, with ghosts that were there, and if you looked up in the windows you could see apparitions, and the kids in the neighborhood especially had all these stories, and they would sneak on the grounds in order to, go up to the windows to see if they could see what was happening inside the wards. And we had patrolmen that had to really supervise the grounds, because kids in the neighborhood, even when I was in nurses training, would want to see what was happening on the wards. People had all kinds of preconceived ideas of the way crazy people acted, and of course soon learned that, the neighborhood soon learned that they were so much like any one of them too, that they had the same wants and needs and dreams as everybody else did.